CNN has reviewed an internal document from the Trump administration that outlines plans to slash the federal health budget. So that could mean that the nation's public health policy could be drastically reshaped under Health and Human Services Secretary Robert Kennedy Jr. I want to go live now to CNN health reporter Jacqueline Howard. Jacqueline, how deep are these potential cuts and how could we all be impacted by them?
Well, Pamela, as for how deep these cuts are, they do include a more than 40% reduction in the budget for the CDC, more than 40% reduction of the National Institutes of Health's budget. And keep in mind, this document is a preliminary memo. It's dated April 10th. So it's not clear whether this is a final plan, but if it is adopted, it could include those significant cuts, which could impact programs that involve HIV prevention, gun violence, injury prevention, youth violence prevention. We're even seeing that under the NIH, it could reduce the number of institutes from 27 institutes down to 8. And this seems to be part of the Trump administration's overall plan to transition the Department of Health and Human Services to what they're calling the Administration for a Healthy America, or AHA. And this document gives us a glimpse into what federal health agencies might look like under that transition. We're also seeing potential impacts on global health and even childcare programs like Head Start. So this does give us a glimpse into what the health policies may look like under the current administration.
I'd like to get some more right now on the massive budget cuts potentially in store for the nation's public health institutions. Internal Trump administration documents reviewed by CNN detailed $40 billion in reduced funding for the Department of Health and Human Services. Joining us now is the Democratic Senator Ed Markey of Massachusetts. Senator, thanks so much for joining us. If these cuts are enacted, what kind of impact is that going to have on public health here in the United States?
Well, first of all, it's a 44% cut in the Centers for Disease Control. That's tracking measles, tracking COVID, tracking any disease which is inside of our country. It's the early warning system. It's the public health system that was challenged as part of the COVID crisis in 2020, 2021. And it not only shouldn't be dismantled, crippled, it should be reinvested in. We've learned the lessons of the past in terms of what the CDC was not able to do. Instead, they're dismantling it. On top of that, they're proposing a 40% cut in the National Institutes of Health research into Alzheimer's, cancer, heart disease, into Parkinson's disease, into all of the diseases that run through the genes, the families of everyone in our country. NIH isn't just the National Institutes of Health, it's the National Institutes of Hope. It gives families hope that they will find the cure for those diseases. And this is a 40% reduction in hope because a whole generation of young researchers will now walk away because there won't be funding for them. And we're going to delay finding the cure for Alzheimer's and cancer and heart disease and so many other diseases as well. And on top of that, they want to eliminate Head Start. Eliminate Head Start. That's 800,000 young people in our country who get extra educational opportunities, help with their nutrition, to give them a head start. What's wrong with the Head Start program? There's never been an argument made that it's not working. They want to eliminate that as well. And again, well, it's all in order to have a tax break for millionaires and billionaires. They have to find the funding for those tax breaks, and they want to take it out of NIH, out of the CDC, out of Medicaid, out of the Affordable Care Act, out of veterans' health benefits, and they need all of those hundreds of billions of dollars to take care of billionaires and millionaires. That is absolutely going to make America sick again. We're going to defund the healthcare infrastructure in our nation.
Joining us right now for some more perspective on this is the former Secretary of Health and Human Services under President Obama, Kathleen Sebelius. Secretary, thanks for coming in. I have a couple similar yet distinct questions on this. If you're back in the position of running HHS, and I said to you, Secretary, you should cut a third of your budget when you're running HHS, what would you say to me, your gut reaction?
My gut reaction, Kate, is that that would be a real disaster for the American public. HHS basically sends money to states and tribes and local communities to run a whole variety of health programs. So this is not money spent inside the DC Beltway. It is money that keeps Americans healthy. And I thought that was the goal of this administration.
So that's the Secretary you should. And what if I said, Secretary, you must cut a third of your budget as you're running HHS? Where do you begin?
Well, I think every secretary spends time trying to make the agency more efficient, trying to, drive the programs as quickly as possible that meet the top priorities. I don't know how you cut a third of the budget and 25% of the workforce without really calamitous results. And that's what this administration is proposing to do. And frankly, Kate, I don't know why. I think the question of why needs to be at the top. Are the programs not working for people? Mental health programs? Are kids not being well educated in Head Start? Are parents not involved? Do you not want any restaurant inspections anymore because, Americans can just roll the dice when they go out to dinner and hope that the kitchen is actually clean and safe? So some of these eliminate. Do we not want research to go on in colleges all over this country that keep Americans healthier, that bring breakthrough medicines to market? Those are the kind of cuts that are being proposed. CDC is the backbone of public health. Slashing that budget by 40% will decimate healthcare in every community in America. So I don't know why this is happening, and I don't know the end goal.
So there's there's that aspect of it, and then there's also what's happening already within the agency. There's an example I want to ask you about because a key NIH official has just resigned. He's a top researcher on food policy, Dr. Kevin Hall. He says in his resignation that his work was being censored. And this is work of the one you think the new HHS secretary would be excited about. He was conducting some of the world's only controlled trials on ultra-processed foods, something RFK is very interested in. But when Hall's study did not show, basically the worst of the worst, did not show that the brain was lighting up in response to sugar like it does to addictive drugs, he says HHS stepped in, saying this: HHS denied an interview request from the New York Times and contacted the reporter directly to downplay our study results because our data might be viewed as failing to support preconceived HHS narratives about ultra-processed food addiction. My written responses to the reporter's questions were edited and submitted without my approval. If that's the case, that means what to you when it comes to trusting RFK Jr.'s version of this agency?
Well, unfortunately, Kate, I think we've already seen undermining of scientific evidence by the first Trump administration, a determined effort to counter scientific facts with narrative that really didn't make sense according to scientists, really didn't provide cures. I think now we have a secretary who not only is a vaccine skeptic, and we see that in his public comments on measles and outbreaks. He's congratulating doctors for curing measles when scientists will tell you very clearly there is no cure for measles. But, to doctor and alter scientific facts, to withhold information from people that don't comply with the facts as you want them, to make up a narrative and then really tamp down any evidence to the contrary, that narrative is really dangerous. It gives Americans false choices. You don't get reliable information. People who are, trying to feed their kids in a healthy fashion, trying to make good decisions, are now left wondering whether or not the information they're getting makes any sense at all, whether they're getting nutrition facts. So I think it's a very dangerous path for a new secretary to start down, interfering with scientific evidence, trying to censor material, whether it's about medicines or foods or research at large, that's a very dangerous precedent to set.
Yeah, the management of such a massive agency is something that I know I've leaned on you several times now to get that perspective, because it's the management and how they are restructuring the agency that is a huge part about this discussion and the overhaul that's occurring.